I am also really proud to be moving a second reading amendment to this bill on behalf of the Australian Greens. In this country, we have a quiet crisis where so many people cannot afford to access dental care. Now, many in this place and in the community will know that the Greens are calling for the mouth to be considered as part of the body with getting dental care into Medicare. The Greens took a policy to the last election to put dental care into Medicare so that everyone with a Medicare card could access the dental care they need without breaking the bank. The reality is that too many people cannot access the dentist because going to the dentist is far too expensive, and most people are not eligible for public dentistry. For those that cannot access public dental services, the wait times can be years. Years of living with preventable tooth decay, headaches, and in many cases, not being able to eat the food which they once enjoyed. My amendment today calls on the government to fully fund and implement a seniors' dental benefit scheme. The establishment of a seniors' dental benefit scheme would go some of the way to supporting our community to get access to affordable dental care. Now, this idea of a seniors' dental benefit scheme is not new. The community and the sector have been calling for this for years. Notably, the Royal Commission into Aged Care Quality and Safety back in 2021 recommended this very scheme, and the Senate inquiry into access to dental services recommended this in 2023. Years on, we still have had no action. Years of people living with preventable dental pain. Yet this government continues to leave older Australians out in the cold when it comes to their oral health. Now, there are many, many stories of the consequences of successive governments failing to establish a seniors' dental benefit scheme. I would like to share with you the story of Don Batty, who was featured by the ABC in an article published recently. Mr. Batty is 80 years old. He is receiving the pension and he is experiencing severe dental issues. The way he describes it, and in his words, is that my teeth have started to disintegrate. I am very embarrassed by my teeth, and I try not to smile because I frighten people. Don has been living with this for 2 years because he can't afford to see a private dentist, and the public system is swamped. Don's story is one that I'm sure will resonate with senior Australians all over the country who are struggling to afford dental treatment, treatment they desperately need. The consequences: people are losing their social connection, it's impacting their mental health, and in many instances, people are struggling to eat the foods they once enjoyed. Mr. Batty's experience is adding to the chorus for change. It's stories like his that are why the Australian Greens are calling on the government to establish a seniors' dental benefit scheme as a step towards bringing dental care into Medicare for everyone. Older Australians shouldn't be spending their retirement dealing with dental pain or missing teeth or the negative health effects that accompany untreated dental problems. Yet here we are. On average, Australians over 65 have lost 14 teeth. 25% avoid certain foods due to dental issues. The reality is that across Australia, people are experiencing the cost of living crisis, and 55% of Australians over 65 delayed dental treatment in the last year, with affordability being the main barrier. The Australian Dental Association supports the establishment of a seniors' dental benefit scheme. The ADA, in collaboration with Primary Dental, at Maroubra Medical and Dental Centre in Sydney and the University of Sydney conducted a pilot program of a seniors dental benefit scheme which included individualised dental plans as part of a GP-provided healthcare program. Now, the results of the pilot showed an improvement in health outcomes, particularly in the management of tooth decay and gum disease. A participant in the pilot said, and I quote, "Public dental waiting lists are too long, and I haven't seen a dentist in 5 years due to cost, and it was painful to eat and drink. Since I was on the pilot project, I have my new denture, and I can eat a lot of food and drink than I could before." The data is in. The pilot clearly demonstrated the value in providing affordable dental care to older Australians. We should make sure that people in their retirement, on the pension, struggling, can live free of dental pain. We should make sure that they can eat the food and drink the drinks that they once enjoyed and smile without fear, that they can smile again with pride. The next step must be for the government to commit to implementing the Seniors Dental Benefit Scheme. I call on everyone in this place to support our Greens amendment, to support in principle the establishment of a Seniors Dental Benefit Scheme. And while this amendment today will not establish a Seniors Dental Benefit Scheme, it sends a clear message to the Australian community, especially our older Australians, that we are going to get this done in this term of government. Otherwise, it is clear that the only party here who are committed to considering the mouth as part of the body and getting dental into Medicare is the Greens. And I foreshadow this second reading amendment as listed on sheet number 3360. Let us work together to bring dental care into Medicare. Let us begin by helping our seniors who are living in dental pain, who are losing their social connection, their mobility and their health due to this unacceptable gap in our health system. It will take work together. It will take time and consultation and collaboration. But let us now begin. Thank you.
Authorised by J. Steele-John, Australian Greens, Canberra.